Good day, everyone, wherever you are in the world. I'm delighted to be here. Thank you to Dapo and Elena for organizing this. I'm here today to go big, bold, and futuristic. I'm trained in science and medicine, so I could do the detailed piece here, but the role that I've been asked to take today is to go big and bold and futuristic. And my colleagues that will be following me are much smarter than me, and they'll be filling out this vision. So let me paint you the canvas to start with, and then we can fill it with the further talks, and then we can talk about how it all integrates together. Really today I am going to be talking about the work of the OECD Purdue Institute Neuroscience Inspired Policy Initiative, and I encourage you to check out our website and you'll be able to see more about it. Next slide, please. So you guys know very well that we have a cognition crisis. Adam Ghazali has coined this concept of the cognition crisis, and I think it's really serious. I think that even beyond these clinical disorders that are in psychiatry, neurology, and sort of chronic disease, that cognitive issues are broader than that, right? We've got sort of the effect of social media and digital devices on our cognition, fraying our attention. And then we have things like science denialism against climate and COVID-related science that Bruce Miller has written about from UCSF that is actually neurologically rooted. So we have a range of these cognitive issues. And if we don't address this cognitive crisis at a global level, what does that mean for us all as local communities and as countries and as the global village? Like, can we really sustain if we don't address this? So one of the reasons why I'm so excited to be here today is to really say, like, we need to work and think about this cognitive crisis, because I fear what will happen if we don't really pay attention to this. Next, please. So when we're thinking about how to address the cognitive crisis, we need to, I think, we need to be meritorious in our work in our own silos. We have people doing great work, driving forward cognitive enhancement in different fields, psychology, psychiatry, neurology, etc. But I think if we're going to really address this, we need to break down the silos or smash the silos and bring it all together transdisciplinarily. Or also called convergent approach. That's what I'm going to argue that we need to do today. And I think you'll see from all the panelists that are involved today that they're very convergent thinkers. So let's really make this a transdisciplinary effort to try to tackle the cognitive crisis. Next slide, please. So I think we have entered this era of convergence brain health. This is transdisciplinarity relevant to brain health. We need to have not just clinicians, scientists, and technologists, probably most of whom is in the audience today, but let's involve engineers. There's probably a few here, but let's also involve economists. Economists can develop new narratives for us, new narratives about how our work in psychiatry and neurology and brain health fits into the global economic context. They're really important. Entrepreneurs as well. I'm sure a number of you are either entrepreneurs or harbor those ambitions. So you are important. You are the people that will take science and technology and engineering solutions out of academia or medical research institutes and actually deploy it into the marketplace so that patients and clinicians can get access to it. So all of these different people have a really important role in the ecosystem and in tackling the cognition crisis. Next slide, please. This is a book that we published in January of this year. Some of the notable chapter authors include Vikram Patel of Harvard, Ipsit Bahir was involved in a chapter, and various other luminaries from around the world. And what we tried to do with this book is go from the theory of transdisciplinary needs in neuroscience, mental health, brain health, all the way through to practical examples, and then through to sort of funding mechanisms and how we operationalize convergence issues here. So if anyone's interested, you can check that out, or check out some of our summary papers that are written on Psychiatric Times or various other journals. You don't necessarily need to buy the book, you can just see the sort of distilled version. So clearly, technology is important here. Achille Interactive, who's hosting this session, is an exemplar of a brain health technology. But there are broader brain health technologies as well, right? And you all know about them. I'm sure that there's been many different presentations at this conference of these different bits here of these 8 different boxes. So all of these things play a role in addressing the cognition crisis. I don't know which one is best for addressing the cognition crisis. I think they all have merit in some way, and we can talk about, why or why not we think different ones are better or not as effective. But let's try to think broad as we think about a systemic approach to addressing the cognition crisis. Next slide, please. So measurement-based cognitive care is a new approach to clinical care that we've developed at the Protea Institute, which, as Dapo mentioned, is really a kind of radical think tank. We've written a paper about this. I'll share the slide with the paper details, I think, next. But measurement-based cognitive care is this big scaffold. So we say that, cognition should be a new vital sign. I think Maduka Trivedi at UT Southwestern says that depression is a new vital sign. So I say, great, Maduka, that's awesome. Let's also say that cognition is a new vital sign. So I think he says depression's the 6th one, so cognition can be the 7th one. And let's get Maduka on next time to talk about that. He's a great guy. We obviously need new digital technologies and biomarkers to actually track cognition and see about, how do we predict cognition? How do we track it? How do we look at treatment response to different interventions? You all know of these different types of technologies, whether they're digital, different types of digital technologies, or even biological biomarkers, blood tests, et cetera, et cetera, et cetera. They all have a role in this measurement-based cognitive care model. And I think that measurement-based cognitive care, of course, can help us to measure the actual therapeutic impact on cognition of different interventions, talking therapies, physical therapies, drugs, et cetera, et cetera. We want to get kind of granular at looking at what is the sort of granular difference of cognition over time. And then finally, a very radical thought here comes from a wonderful colleague of mine, Erin Smith from the Protea Institute. She's also now at the UCSF Global Brain Health Institute. She coined this concept of a cognition counselor. So, like a genetic counselor is important for predictive genetics. Well, we now actually, as you all know, right, we have a lot of new age predictive cognitive tools. We've got, C2N diagnostics, for example, which has got its blood-based biomarkers. We have novel PET, novel imaging, novel types of affective computing, et cetera, et cetera, et cetera. But are clinicians really ready to sort of deal with that, to explain to patients, just like they have to with predictive genetics, with say Parkinson's disease or something? Are they ready to do it with cognition? So maybe we do need an entirely new workforce of cognition counselors, people that actually understand the gamut of these new technologies and can explain it to patients, work with psychiatrists, work with neurologists, work with psychologists to make sure that we're responsible in providing cognitive care, cognitive counseling. So that's a heretical view of an entirely new workforce approach. Let's talk about that if you want to. Next slide, please. This is the paper that we wrote up. I guess it was a few months ago now. If you're interested in sort of looking at our big vision here, please check that out. Next slide. So brain capital is a novel conceptual asset, let's call it that, a conceptual asset. If we really want to make big change in the cognition crisis, we need to speak in the terms that senior bureaucrats will think about in different governments around the world. What will heads of state think about? What will big philanthropists think about? Philanthropists that maybe don't come from our field, right? Maybe they're made lots of money from concrete businesses. So how do we lock all those people in on this cognition crisis? Well, I would argue to say that brain capital is one simple way of getting them to think about this. Brain capital is brain health and brain skills in the brain economy. We all know what brain health is. Brain skills are just skills relevant to the current world: resilience, creativity, adaptability, problem solving, things that we really needed during COVID just to try to get through and have grit and adaptability to get through it. And the brain economy is really the souped up knowledge economy. You know what the knowledge economy is, but let's call it the brain economy. Let's give it a new name, a new narrative, something that we all can get behind here on this conference here today. Next slide, please. So brain capital is impacted across the lifespan, as you all know, right? So let's just make sure that we don't think about this only in one point of the lifespan. It needs to be thought about across the lifespan. That way, we actually might have a chance of tackling this and dealing with this crisis. Next slide, please. This is a couple of screenshots from the OECD Neuroscience Inspired Policy Initiative. We've been very fortunate to have, coverage in the Financial Times, high-end economics and business newspaper. You can check this out at your own interest and in your own time to see sort of what we've been up to. And I, encourage you all to reach out and help us out with this movement, because it's really a movement. No one person really knows this stuff. We're kind of charting an entirely new field of sort of how does all of our work fit into modern economics and modern policy and modern investing. So it's going to take a village. So absolutely welcome collaboration. Next slide, please. This is just an example of some of the working groups that we have developed at the OECD. We have a brain capital index working group, which seeks to how do we actually define and measure and track brain capital. Maybe it's not just one index, maybe it's like a dashboard of indices, because it is very complex, right? We can talk about that. Brain capital diplomacy, how do we make sure these things occur around the world? Brain capital investing, which it's interesting. There's obviously a lot of new venture capital funds emerging that are thematic around the areas that we all care about, right? Mental health, brain health, etc. And we do have the main thematic policy area that we're working on at the moment is women's brain capital, because we think that that's really probably the most important area to focus on. Next slide, please. This is a brand new paper that came out like 2 days ago from some Canadian co-authors. So I wanted to give them a shout out. This is a really nice visual of brain health in the modern economy and in society. I strongly encourage you to check this paper out. You can see it's really touching on all the things that I've talked about, from, lifespan, psychology, economics, political factors. This is a really helpful rubric, I think, to think through what is the canvas of the cognition crisis, and then how do we tackle it. Next slide, please. This is a new venture fund that's been established over in France by between New Fund, Francois Veron, and Fondamental. Fondation Fondamental is sort of the leading French mental health advocacy group. It's also a clinical trial network. It's also a research sort of think tank. Marion Leboyer, an INSERM professor, runs that. So, massive credit to Marion to be collaborating with venture capital to actually develop a really responsible investment approach. This is not quite publicly released yet, the Hacker Fund, but it will be coming out soon. And it's all about how do you invest in the brain capital revolution. And I'm pro bono supporting these people, helping them to shape their vision. So no conflict of interest there to say. Next slide, please. Final thing I wanted to say, because I wanted to segue to Sandeep and let him get serious about this topic. One of the things, if we're going to sort of think about the cognitive crisis and maybe end it, or maybe just make people more resilient to actually getting into crisis mode, we need to think about resilience. And so one of the things that we're doing at the OECD is thinking about what would be multi-level neuroscience of resilience. We all sort of think about resilience like we can think about resilient neurons, resilience as far as like neurocircuitry, but then we also know, right, that resilience can come from environmental causes, right? So how do I think we need an entirely new form of science to think about resilience, a multi-level science of resilience. And we're very happy to be working with Richard Hunter of University of Massachusetts at Boston on this topic. And the OECD has actually established a large resilience advisory group, of which I'm the neuroscience representative. We also have representatives from history, economics, anthropology, where we're thinking about resilience at a global level for society. And so neuroscience is obviously a really important piece of that. So, but now I think it's time for me to hand over to Sandeep to go deep on the resilience topic. Please reach out to me and let's catch up if you're interested. and talk further, but I hope that was useful as a framing for this panel. Thank you. Thanks, Dapo.
Well, thank you, Harris. That was excellent. I think it brings us into this systems level thinking as well as convergent opportunities.